New Mexico Republicans are often out with a response to the governor's latest press conference within an hour. It's an amazing thing. Sometimes before it's even finished. They've accused the governor of being too restrictive as she tries to slow the growth of COVID-19. What would they like to see? And what science are they looking to? NMIF senior producer Matt Grubbs asked those questions and more to party chairman Steve Pearce.
Chairman Pearce, thanks for taking a few minutes to join us and to really talk about the COVID-19 response. I wanted to start with what you feel like needs to be done differently right now.
Well, we've got to figure out a way to stay healthy, but we must be able to save the jobs. I think that too many people believe that jobs can just be created, and they're not. Our investors, they lose confidence. They lose belief that certain environments will be positive for them. Right now, they're deciding that New Mexico is going to be a not a positive environment. Many people are just closing forever. And so as this pandemic works its way through on the health aspect, it's also having effects in the economic conditions. And as let's say that 201 restaurants have closed already, then people are driving less. And so the state budget is already $2.4 billion short out of a $7 billion budget. So somewhere in the 35% range. So imagine if you're trying to make up 35% shortfall in your personal income. So the state has that. But then when you shut down the restaurants, that closes the gap even more, or it broadens the gap more. And then when you shut down tourism, you have three major hits to the New Mexico economy. And we should be figuring out how to open up, not how to get more restrictive. And that's what should be done differently right now.
It sounds like the governor's approach, at least in opening restaurants in June, was to try to reopen. You've obviously seen what's happened in Texas and Arizona, and to some extent with the resurgence in Colorado and certainly Utah. We're sort of, or we were at least, surrounded by these states. How do we open up tourism and at the same time keep the folks here safe?
Yeah, so I don't think the number of cases is the best measure. It's the mortality. In other words, we're going to have to get some herd immunity at some point, and there are suggestions that maybe parts of the nation are already approaching that. But we're measuring so many more people. Before this last week, 2 weeks maybe, there was nobody in line to check in Hobbs. Now the line is about a mile long to check. Well, obviously, you're going to get more positives, but if you're not getting more mortality, then you've already had those cases anyway. So I don't think it's that we're necessarily spiking up. It's that we're identifying more, but the mortality is remaining very stable. The Center for Disease Control, New York Times, there are different websites that we refer to. And so that would be the better gauge, the mortality rate.
Well, we're looking, I mean, it looks like the state right now is at about a 5.3, 5.4, somewhere up there. That's a fairly serious mortality rate. And what we're hearing from public health officials here and across the country, regardless of political affiliation, is that, they're testing more people, but they're also getting a higher percentage of people testing positive, which indicates that we're not controlling the spread of COVID as effectively as we were. Where do you see science that supports opening up further?
Yeah, so last night a report came out that one of the testing labs that was part of showing that there are greater incidences of the COVID-19, they had put out that it was 94% positives that were testing. And keep in mind that some labs are 100% positive testing. And so at some point, the science should go and look at the results that we're coming up with. That 94% that the one lab that came out later and said, oops, it was 9.4%. And so I don't think we should be making these decisions without digging just a little bit deeper into the positives that we're finding. And again, the mortality rate is staying pretty similar. But if you look at a state like South Dakota, they never closed anything. All she did is said, look, here's what the risks are. Here are the people at risk. You should be very careful. Here are the people not at risk. You don't have to worry as much. And you businesses, if you're going to get people sick, then they're not going to come in your store. So you need to take care of your customers, and they've never shut down, and their mortality rate is less than ours. And so this idea that we have to shut everything down in order to succeed is one that I don't think that it bears up under scrutiny. I don't think Sweden ever shut down. I don't think South Korea ever shut down. Their economies have been good. They control when people get sick. They are very good at isolating them, keeping the spread from going. And that's, I think, the direction that we should be headed.
Sweden's mortality rate is outpacing the rest of the countries in Northern Europe. And in fact, they've come out and admitted that herd immunity wasn't achievable and that it was a mistake. And as you know, South Korea was much more aggressive about testing. It strikes me as we've gone through this process, we have heard folks who are in favor of opening up say things like, well, look at Florida. They opened up and nothing happened. Look at Georgia. And then we wait a couple of weeks and we see the results where Florida is now the epicenter for the globe. There are more cases there than there were in New York. We've seen similar things with, for example, California, but it strikes me that at some point you're just going to run out of states to point to. South Dakota is in fact trending up right now. Again, I don't see that there's science saying that, states like Arizona that have opened up have been able to do so effectively to the extent that they wanted to initially.
Yeah, but you also have to count the other cost in. Right now, one of the medical examiners, the interim chief medical examiner in New Mexico, says she's looking at 2,300 or 2,800 cases of death that are related to COVID, and suicides, car crashes that can't be explained, where it looks like maybe someone just was frustrated. And so you have these costs that are in addition to COVID from the full shutdown. And I think that to simply say that we have to shut everything down until we have no cases is one that has a very risky future to it.
The Republican Party has been pretty outspoken that they're feeling like the governor is doing this wrong. After her recent public health ordering restaurants to close indoor dining once again, you had said that this idea that there's a 25% limit for someone, a 50% limit for someone, doesn't make any sense. But then you also decried a one-size-fits-all solution in the next sentence. So help me understand where you think we should be headed in terms of restrictions right now and mask mandates.
Well, the main thing should be equality under the law. Fairness under the law should be the basis, no matter what party is in power. That should be it. When we have allowed the big box stores to stay open, and early in the shutdowns, everything was shut down and the big box stores were open without exception, and so that unequal treatment under the law is something that we have been very critical of. Also, you note that we were pretty critical when the governor said, okay, Walmart and Las Cruces, you've got to shut down because you had 4 of your employees test positive and they stayed open. And then suddenly they were given that clean bill of health. They had wiped the store down. How in the world do you wipe down a Walmart store? Do you get rid of all the inventory? Do you bring in new boxes of stuff? It's not possible to do in a 5-hour period. It's not possible to do probably in a week-long period. And so that's the unfair treatment under the law that I'm saying. If it's right for some to shut down, then why is it okay for big box stores to be open? I never understood that. You get far more congestion in a big box store than you do a small business. Small businesses, they'd be lucky to have 10 people at a time in the store. They'd be ecstatic about it, but they could at least keep them separated. That's been the main complaint we have. We've also been very critical of the governor because she is taking the penalty under one law and applying that $5,000 penalty that comes under one law over to the law where she's able to give her executive orders. And we're very critical. That's the case we're taking to the Supreme Court. I know that we're right on the law. I'm not sure that the Supreme Court will agree with us.
Where are you on mask use? Do you feel that it's effective at stopping the transmission of the virus? And if so, should everyone be wearing one?
Well, what I feel like is that we're getting mixed signals. Dr. Fauci has said that it does no good, and then he came back and says that it does good. And my point
Well,
of
just quickly to
observation,
interrupt,
just
sir, and
no,
I'm
wait,
sorry,
let me
but
finish
just to
this
make
one
clear
point.
here,
Just let me finish this one point, that if the masks work, why didn't we put them into the jails instead of turning felons loose, turning prisoners loose with felony convictions and putting them back into society to keep them safe? If they work, they had social distance. They're in different cells. We can put them in different cells, but we didn't give masks. If they work, why didn't we do that instead of putting felons back into the system? So there are questions that I think legitimately present themselves from the actions that we see both nationally and in the state.
Well, I think you're talking about a very small number of people who've been released, and under state law that allows for them to be released in certain situations. You've seen what happens in Otero County with that facility where there was a massive outbreak. I'm not quite sure. The science has been evolving. You referenced Dr. Fauci first saying one thing and then saying another. That's because this is a novel and new virus, and more people are studying it. Doesn't it make sense to follow that science as it evolves?
Yeah, I'm happy following the science, but make sure the science is right. And viruses are not new. Viruses have been with us since humanity. And so the idea that suddenly we have a novel situation,
virus, Chairman,
that viruses act very similarly. Viruses act very similarly. This is a form of flu, swine flu, bird flu. This is a form of that flu. And yes, it may act a little bit differently, but viruses are very, very predictable.
All right. Well, Chairman, we appreciate your time. Always there are more questions than we have time to get answers to, but I appreciate you working with us and finding a time that works.
Always happy to do it. Come back on and let's talk more. These are the conversations that I think that New Mexico should be having.